a new system, a Zoom meeting. So bear with us as we're working through all the nuances of this new system. But we're excited to have you here with us today. We usually take a break over the summer with a Mito Expert series, but because of the feedback that we've received from the community, we've decided to expand the series to run year-round. So you'll be seeing the announcements about these expert series calls happening every single month, 12 months out of the year going forward. And so we're thrilled to be back with you today to kick off the new year of the series. So as I said, we're now using the Zoom meeting for the presentations so that you can either log on online and follow along live with the presenter slides, or if you prefer, you can still call in via phone and follow along on your own. So now we have that added feature. As we go through today's presentation, if you have any questions, feel free to submit them using the chat feature. There is a menu at the bottom of the bar of your screen that says chat. If you are following along with the presentation online, or if you're on the phone calling in, you can email your questions to info@mitoaction.org, and we will begin the Q&A at the end of today's presentation. So we're excited to have with us today Mary Castro Summers. Mary is the parent of 3 adult sons, and her youngest was born with complex health needs. For the past 30 years, she has relied on research skills honed as a paralegal with her personal and professional work experience with the New England Regional Genetics Group, the first project at the University of Massachusetts Medical School, Family Ties of Massachusetts, and now Franciscan Children in Brighton, Massachusetts. As a member of the Marcel's Way Committee that reviews applications for our Marcel's Way Family Fund at Mito Action, Mary has learned of the impact of mitochondrial disease and has assisted many families in finding local community resources to address their needs. And Mary has been a part of this committee for 5 years. Mary is passionate about community resource information sharing and making connections among families supporting children and adults who have special healthcare needs. She was personally supported by others and enjoys paying back those acts of kindness. Her motto in this work is, "You may be caring for your loved one by yourself, but you should never feel alone." So please join me in welcoming Mary.
Kyra, thank you for that introduction, and it truly is a pleasure to be a part of this group. I have very much enjoyed being a part of the Marcel's Way community. My son's complex health needs are quite different from the challenges that the Mito community faces. However, it's Matthew who inspires me to do this work. So I appreciate the opportunity to be a part of it. And I think, as Jeannie will attest, I love to help families to navigate the complex government and social systems of support that really can increase the level of services, the types of supports that a family can have, and again, to try to reduce that feeling that you are all by yourselves at home. Next slide. So just a quick primer for me more than for you is how might mitochondrial disease affect you or your loved one. And I know that it's quite diverse. Here at Franciscan Children's, even more than with my work at Family Ties, I've come to know so many families whose children have the underlying diagnosis of mitochondrial disease, but poor growth, loss of muscle coordination, muscle weakness, those are all connected. Unfortunately, seizures are a part for many of our children that we meet. Autism, problems with vision and or hearing, developmental delays, learning disabilities, heart, liver, and or kidney disease, GI disorders, the big one that I see here at the hospital, diabetes, increased risk of infection, which is huge in the community as well. As we know, if you have a weakened immune system and reduced physical structure to support the kinds of infections that you may meet in our world today, it means that you're more likely to be hospitalized and potentially have more serious repercussions. Thyroid or adrenal anomalies are also noted, and autonomic dysfunction is huge, and dementia. So the Genetic and Rare Disease Information Center, I've given you their phone number, and they're available online as well. is a great resource to find more information about this diagnosis and many others, as well as contacts for professional groups such as Mito Action that can help families to find information and resources. Next slide. So what types of help matter? As we look at the structure of this slide, healthcare needs, emotional support, basic needs, and community services, it's glaring to me that basic needs is actually third on the list. For those of us who have children or family members, or we ourselves are affected by severe medical concerns, we see that healthcare needs bubbles up to the top. And frankly, if you're dealing with healthcare needs, I hope that emotional supports are right behind that. The basic needs do come next in line, and we're going to tackle these as well as community services as we talk today. Next slide. So healthcare needs is a pretty broad conversation amongst our families. Healthcare needs includes health insurance, and for many families, they're lucky to have employer-sponsored health insurance, or perhaps through the Medicaid buy-ins, or perhaps through your state's services that are providing health insurance to families who can't afford it through other means. But Medicaid should be top on your list if you have a child or you are a person under the age of 65 who has mitochondrial disease. Medicaid in many states is actually available not only as a primary insurance but as a secondary insurance. And here in Massachusetts in particular, we call it common health. So folks would apply for Medicaid. They would state up front that they know that their family finances would not allow them to get Medicaid as a standard benefit. However, they want to fill out what we call the disability eligibility form. And that form in particular helps to introduce common health, the secondary insurance, or insurance that's bought into. Families, just like for if they had commercial insurance, would be asked to pay a premium. But here in Massachusetts, we also have a premium assistance program. Several other states as well have premium assistance programs, so that it's really unattainable for you to be able to continue to pay the premium that they've given to you. There's a place for you to go and talk about that. In Massachusetts, our premium assistance program not only covers the cost of the secondary, that common health insurance, but may pick up some or all of your family's health insurance if you're lucky enough to have commercial insurance. The thinking behind that, I've always been told, is that Mass Health, our primary Medicaid program, would be delighted if you would carry a primary insurance that covers the bulk of the costs. However, those costs that are not covered either because of the details of your commercial plan or because you've exceeded the limits that are placed on an annual basis on your insurance have been met, then Mass Health will kick in, and as well if there are benefits that they don't cover Mass Health, as long as it's the service is provided through a health insurance, through a provider that accepts Mass Health insurance, then they will cover that as well. The biggest benefit for us in Massachusetts that we see Mass Health picking up as a secondary insurance, of course, is block nursing or home care nursing. As children or adults start to have more and more medical challenges, it's often necessary to have someone to come in and do not only daily assessments like a visiting nurse would, but also to provide medical care. And if a child has more than two, or adult has more than two skilled services that need to be provided, then you may request through your Medicaid program to come out and be assessed for home care nursing. Unfortunately, as I have to say often to families here at the hospital, what you need to know about home care nursing here in Massachusetts and in other states as well is that the state may offer you home care nursing, but the challenge is finding home care nurses, because home care nurses, nursing agencies continue to struggle with maintaining enough staff to be able to provide the service to everybody who needs that kind of assistance in the home. But insurance is certainly key for all of us. And if you know somebody who does not have health insurance and requires services, particularly because of mitochondrial disease, please make sure that you reach out to the Medicaid program in your state and let them know what your needs are. In terms of medical services in particular, there's doctor visits, hospital stays, outpatient therapies, imaging services, laboratory services, and medications that are covered through your medical care. And it's important for you to know that those should be benefits that are in your health insurance. If you are receiving insurance through a commercial provider, through, for instance, your employer's insurance, it's important for you to give feedback to the personnel manager in your office about the kinds of services that you need, because sometimes commercial insurances would allow for a rider or a separate special policy to be added for somebody to allow for them to receive expanded benefits, depending again on whether or not they have that as an offered benefit, and number two, if you can afford that extra rider. But I'm personally aware of families who have gone in and helped their personnel staff to understand what their child's complex needs are, and those personnel staff have then gone and helped to negotiate more robust health insurance plans that are supportive not only for the one child or family member that they were talking about, but in fact many that the provider that the employer may not have been aware of. So it's important to keep that communication going. In terms of in-home services, again, there's visiting and block nurses, there's infusion services, short-term therapies. There's all kinds of services that are available in the home. Here in Massachusetts, we also have the Children's Behavioral Health Initiative, which can help children who have emotional or behavioral challenges to come into the home and work one-on-one with a child to help in addressing the emotional side of their challenges, and also to help with behavioral support. That program in particular, which we call CBHI, also offers a parent mentor. So it's another parent who's been hired by the agency to come out and support the mother, father, grandparent, whoever is considered the parent in that family for that child, to help them to work through the challenges that they may have emotionally and to support the behavioral supports that they're trying to bring in for their child. So check into in-home services, particularly important for some of our family members who are really medically fragile, and it's important to advocate with that person's primary care physician if it's really a challenge to take somebody out of the home to go to services, whether it's therapies, physical therapies, occupational therapy, speech therapy, feeding therapy, and also emotional services. Durable medical equipment is something we know a lot about here at the Rehabilitation Hospital where I work. I get to see kids using wheelchairs and walkers, crutches, talk to families as they're getting ready to go home about do they need a lift or an elevator or ramps at their home. Bath equipment is important, of course, safety, particularly in the bathroom where if you get wet, it's easier to slip and fall, especially if someone else is trying to physically help you to do that. AFOs and braces are really important too, particularly when you have challenges with gait. And those should be all services that are covered by your durable medical equipment insurance benefit. Again, if it's not being appropriately or adequately covered, make sure that you talk to the person that's managing your account for you. Also, I want to point out here in Massachusetts and across the country, actually, there are programs that are run typically through the Easter Seals programs in your states that can take equipment, durable medical equipment that's no longer needed, and refurbish it, so that particularly for folks that have limitations, financial limitations, whether it's because of their limited insurance benefits or they're paying out of pocket for things that their doctors are not writing scripts for, but they feel it would be helpful to them. Those DME programs, like the re-equipment, we call it here in Massachusetts, it's equipment with an R at the front, is run through our Easter Seals program in conjunction with our Mass Rehabilitation Commission, and they help so many families to receive things like bed risers, the rail on the side of a bed to help somebody to easily ambulate in and out of the bed. They have bath equipment, lots of different kinds of bath equipment. They can help with wheelchairs as well. If someone outgrows a wheelchair, it can be passed along, gently retooled, and then be ready for somebody new. And we here at the hospital help lots of families to get wheelchairs through the re-equipment program, but also some of those other luxuries. In terms of ramps, I want to point out that number one, it's not easy for everybody to build a ramp, or it may not be feasible for you to build a ramp. So it's important for folks to either look at what their personal homes need and then talk to a qualified individual that can help you to map out the best way for egress from your home. But there's also local charities that will help to build ramps if you need help. The Home Depot actually has a wonderful foundation that's helped thousands of families to build ramps at their home. It's a matter of looking for your local Home Depot, asking if they can help you to be put in touch with their foundation, and also ask if they'd be willing to sponsor you to be a part of that. Lots of times we've heard of vocational high schools taking on ramps to do that, and we have a local Eagle Scout here in Massachusetts that took on the project of building an accessible ramp for a nature walk here in our town, which was really wonderful. Ramps are also available here in Massachusetts through Easter Seals. They can lend a ramp for a month at a time, as long as they have one available. They have 6, 8, 10, and 12-foot long ramps, and they can use multiple ramps if it's a very long egress for a home. So again, thinking about the things that you need at your home, please don't be afraid to ask for help. And in terms of who do you ask, I would suggest that you talk to either the nurse practitioners in your primary care office. If you're working with orthopedics or working with a Mito specialist, ask them to help you to connect with the community groups like Mito Action that can help you with those questions. Pharmaceuticals is a big deal, especially in your community. Prescriptions, of course, are needed for so many of the medical challenges that come with mitochondrial disease. The over-the-counter medications are sometimes covered by Medicaid, so if you are a Medicaid recipient or Medicare recipient, you should ask for the list of approved over-the-counter medications. Medical supplies is also something that our families tend to need a lot of, and again, if it's covered by your either primary insurance or your Medicaid, it should be a big help to you, particularly as we find with incontinence products. That's a pretty expensive out-of-pocket for families. And here in Massachusetts, any child over the age of 3 who has a documented medical condition for which incontinence may be an element can receive their incontinence products through our Medicaid program. Again, whether it's primary or secondary insurance, doesn't matter. They're going to receive that kind of a benefit. The one big deal, I think, when it comes to your community are those compounded cocktails. And at Mito Action, we have received numerous requests from families hoping for some financial assistance to help to pay for compounded cocktails. That's a complicated question for us. We always want to help the families and certainly would consider the request. What worries us is what happens when that contribution to the family's income for that one-time opportunity goes away. And that's sometimes where I get involved with families individually to talk about what kinds of services might they be able to avail themselves. Are there other nonprofit organizations in their state that might be helpful? And is there a way for the physicians who are involved in recommending those compounded cocktails to talk with insurance and see if they can get them covered? I do see over and over again the number of families who are using the cocktails and have had good success, but the challenge is the financial aspect, which is really hard. Alternative therapies are something that more and more commercial insurances are covering. Homeopathic and natural remedies, acupuncture, meditation, yoga, and mindfulness in particular. There are lots of ways to find those services out in the community, and sometimes at very low cost. Senior centers are particularly helpful in finding services at a low cost. Many times they will run programs for the community. We have a local community hospital that runs meditation, yoga, and Tai Chi classes, actually, for seniors, and anybody in the community is welcome to join them. So if you'd like to do those, if it's financially challenging for you, consider looking to your community hospitals, the senior centers, and talking to your neighbors about does anybody else use some of these services and where do they get them from. outpatient services and therapies like OT, PT, and speech or feeding therapies are really important for folks who have some challenges, particularly around stamina. We have found here in our hospital, we give intensive inpatient services up to 2 times a day for each of the therapies that a patient needs. But when they discharge to home, it's greatly reduced. For children who are in school, they may be getting OT, PT, or speech. Unfortunately, it's not focused on the medical side of things, but what are the services that they can provide to improve the child's endurance and performance at school. If a child needs more than what the school is providing to them, really does need medically based outpatient services, it's important to talk to the child's primary care physician or the metabolic specialist that you're working with and request that they consider writing scripts for you to be able to do that, present it to your insurance. Again, here in Massachusetts, our Medicaid program actually provides for up to 20 sessions per year for each of the therapies. If someone needs more than that, they simply need letters of justification. It does take some work to get the letters of justification approved, but it's worthwhile to know that that can happen. For psychological supports and counseling, all health insurance in the United States is supposed to include parity or equal level of services for medical conditions and psychological and emotional challenges. So if you are not availing yourself of psychological supports or counseling because you think you can't afford it, please talk to your primary care physician and help them to connect you with community supports that they feel would be a benefit to you. And I can say for folks, I know that in the past in our culture, it was thought to be a real hindrance that somebody should seek out psychology supports or to think that they need counseling. But for those of us, myself included, who have children with complex needs or family members that we're caregiving for, it's really important for us to take care of ourselves, the adults in the family, if it's children that we're talking about. If we don't have the energy to take care of ourselves, we're not going to have the energy to take care of our children in the way that they need it. And for adults who have mitochondrial disease or other complex medical conditions, again, it's quite a burden. It's quite a burden on your emotions as well as your physical means to be able to get around knowing that things are challenging for you. Having a safe place to talk about this is really important. I just had a conversation with a mom yesterday who thought that her child always talks to me, and I said, but it's important for you to recognize that sometimes our children don't want to tell us everything on their minds because either they see us as already stressed and don't want to add to that, so they're protecting us, or they themselves don't know, they can't sort out what they're feeling, and again, they don't want to burden others with that. So giving them a psychologist or a counselor who can help them to sort through their feelings, any one of us sort through our feelings about what's happening to us, and then to try to normalize what is a very stressful situation you're living with. That's really important. We touched on home accessibility with ramps and stairs. Stair lifts are really helpful in the home. We're actually looking at one for my mom, and I was surprised to find out that you can rent a stair lift. So if you don't think it's going to be a long-term need in your home, whether you're not going to be in the home a long time or you don't anticipate the need will be there for a long time, check with the local stair lift companies and ask if they would do that. For your information, it was a one-time payment to bring it in and then to take it out. And in addition, there's a monthly payment that would be used. But it's worth considering. It's not nearly as expensive as I thought. And the other piece of it is that if you have a family member who really does have difficulty on the stairs, it may be a benefit that you could advocate for through your health insurance. Medicare is also one insurance that does offer stair lifts, so it's worth talking about. And it's far less expensive than elevators, which are definitely not possible in all homes as well. Lighting and sound devices are also helpful for someone who has limited movement or limited vision or has sensitivity to sounds. There may be ways to help to support a person in that way. Thinking about home accessibility in the kitchen, appliances and counters need to be sometimes adjusted for the needs of a person who uses a wheelchair or has difficulty with lifting. and bathroom accommodations. The roll-in shower is pretty popular amongst the families that we work here. Sometimes a bath, there are now new bathtubs that you can swing the door open and close it and then turn it on if you can't get up and over. Having the bath chair has been useful for a lot of the children who are learning after medical complexities to be able to give themselves baths but want to be safe by sitting down. These are all different kinds of services that are available and all related to health care. And hopefully you'll access your Medicaid in your state or contact familyvoices.org if you don't know where to start. And National Family Voices is an organization established by families of children and adult members who have complex medical needs and help other family members to identify what are the resources in their states. And through the Affordable Care Act, I'm happy to say that every state has a Family Voices chapter that serves as the Family to Family Health Information Center. So go to the Family Voices website, tap on the map, find your state, and you'll find the contacts and hopefully open up the avenue to finding supports for insurance. Next slide. Thank you. Going back to emotional support again for affected children or adults, and for those of us who are caring for family members and friends who have complex needs, it's really important to know that your emotional health is a priority. When we address the emotional needs of an individual, they have more energy to address their daily needs and to enjoy life and see the joys in life. So find others who know your personal situation. Peer support is something that I have lived my life on these last 31 years. I know you, like myself, are dealing with challenges that I have. And in finding another family member whose child or adult family member has the same condition, mitochondrial disease in your circumstances, helps to, number one, again, tell you you're not alone in this, and that there's someone who can offer their good ideas, explain their situation and how they've managed certain issues that you may share. And although we know that everyone's situation is unique, we can learn from each other's experiences, feelings, resources, and outlooks that they have. So I encourage families of children with special needs up through age 22 to contact your parent-to-parent network, which you can find through the website p2pusa.org, or a Center for Independent Living, which in Massachusetts, we call them the ILCs. ILCs are organizations that have federal and state funding and can offer practical advice, counseling, and assistance related to community living, government and community resources, job training, support services, and opportunities. So ILCs are a really important resource for you as well. Mito Action, of course, is another resource for you in finding emotional support. Programs like this help you to build your information base, but it's also a way in connecting through Mito Action you can find other families too. It's important to think about your spiritual and philosophical needs, as we do need to consider the everyday challenges that we face and how they affect our lives and overall. Next slide. Finally, we get to our basic needs. So financial assistance, how can we help to make ends meet? Food, we need to feed my body and nurture my soul. And housing, everyone needs a roof over their heads. Transportation, help getting around town is important too. So the resource programs you should know about related to these topics are Social Security, whether it's SSI or SSDI, SNAP and food, sometimes called food stamps, and the Department of Transitional Assistance in your state. So SSI is supplemental security income, and it's a way to bring some funding into a family for a person who has never worked or has a very short work history, has complex medical situation which impacts their ability to go to work. It may actually also be used for children who have special health care needs. So the difference is between children and adults. For children, their family's financial assets are considered their assets. So if you fill out an application for SSI for a child under the age of 18, even 17 years and 11 months and 30 days, if it's a 31-day month that they were born in, You've got to realize that the family's income is part of that application. So the parents may be making too much money for the child to receive that benefit. It sometimes is important to go ahead and apply if you're close to the limits, which can be found on the Social Security website. The reason that I tell you that is because even if you're close to it, you may only get $1 or $2. We've heard of families that get that little amount. But as soon as you apply for SSI and you're approved, yes, you have a medical condition that makes you eligible for SSI, it means that you're also automatically enrolled in Medicaid in your state. So it's a different way to get into Medicaid as opposed to going the more direct route in applying for Medicaid. SSI is a benefit that in adulthood at the 18th birthday, if you apply for a person for SSI, the only assets that are counted are the assets in the name of the child, now young adult. So long as someone has less than $2,000 in the bank with their name attached to it, that also includes bonds. If someone gives you savings bonds, that's an asset of the child, now young adult, that'll be counted towards their limit. But social SSI benefits are really helpful for the families that we meet. The lowest benefit here in Massachusetts is around $550. The highest benefit is around $770, which is a big help to families who may be struggling with one parent needs to stay home and take care of the child with special needs. It may be that the person has to work part-time or have flexibility in their schedule because of the medical needs of the child. For adults who are applying for SSI, again, they may be only able to work very short hours because of the medical condition. It's worth looking into SSI mainly to get the Medicaid benefit, but indeed the financial benefit is also helpful. SSDI is the Social Security Disability Insurance. It's a completely different program, and it's for folks who have more than 10 quarters of documented work. So they paid into Social Security. Remember, that's part of the deductions on your paycheck every week. That SSDI will cover a person who no longer is able to work. So once you get to the totally disabled place in the scales, they're going to then approve you for SSDI. That's a much more complicated system, and it's worth going in and visiting the local Social Security office if you can, if you feel that that's the route that you need to go. But again, approved for SSDI means that you're going to automatically qualify for Medicaid in your state. Really, really important. In terms of financials, in most states too, there's also the emergency aid for dependent children. And that may be a way, again, if a parent is at home giving total care for a child and not able to work, the EAFDC, as we say in Massachusetts, is a financial benefit that's based on family size and the number of children that you're caring for who are under the age of 18. In terms of food benefits, the SNAP program, we used to say food stamps, is really, really helpful for families. It goes on family income and family size and the number of folks who would avail themselves of the kinds of foods that are available through food stamps. WIC is for families who have what's called Women, Infants, and Children is a program. If the family has a child who's under the age of 5, they may qualify for WIC benefits for the child. And for pregnant women and nursing women, they also can receive, again, additional food stamps or SNAP benefits. Many states still have surplus food programs. That was a government program. Actually, my mother helped to start here in Massachusetts many years ago. And it continues in different iterations. There are fewer government direct-to-consumer programs. However, the food banks have become the place where folks go for food. Food banks, food pantries, and charities help most families in need for food. Housing is the most difficult resource that there is to identify. I say that from personal experience of looking for so many families. We have Section 8 vouchers that can be available on a federal or a state level that can help to reduce the cost of housing to a family. However, waiting lists are very long on Section 8. It doesn't mean don't get on the list, because I'm a firm believer If you're going to need the benefit into the future, just add your name to the list now. Time's going to change. Time will go on, and eventually your name will pop up to the top of the list. For individuals who are adults who have special health care needs and are utilizing services like programs like SSI or SSDI, you can turn to your states or your local communities in Massachusetts and ask if there are any Section 8 vouchers that they can avail themselves of. So again, it's another resource to consider. Government housing is another option. You see a lot of that happening here in Massachusetts. We also have affordable housing, which is harder to get, and I like to say it's affordable according to whose scale of pay. And cooperative living is becoming more and more popular. In Massachusetts, we also have a program that we call AFDC, or Adult Foster Care. It's not really about adult foster care, but it's a state program that helps to financially support a person who needs others to care for their needs. And so AFC is a program that you can look into if you're here in Massachusetts. And if not, check in with your state and ask if they have a similar program. I'd be happy to talk with anybody individually if there's questions around that area. Transportation, not just about getting the medical services, but let's start there. So Medicaid in many states does have a benefit that pays medical transportation or reimburses Medicaid recipients to be able to get to medical appointments. Here in Mass, we call it the PT1 service. We actually do limited financial reimbursements. However, the program is happy to arrange for rides, whether you need a cab to get you to a medical appointment, a wheelchair van to get you to a medical appointment, or a stretcher car or an ambulance, depending on your medical needs. So PT1s assure folks that you can get to the doctors. And I remember from working at UMass Medical School years ago that one of the biggest challenges that they had, and it continues today, is getting people to come for their appointments. If the issue is transportation, please talk to the care coordinator or the nurse practitioner in your primary care physician's office and let them know that you need help with medical transportation. In some states, as we learned here at the hospital, some states will reimburse families who have to come, for instance, to the hospital for teaching to learn how to care for their child's complex needs. In one state locally here in New England, all you need to do is document that the parent came in for those appointments, which that information is documented in the child's medical record anyway, so that's easy for us to do here in the hospital. But out in the community, for other states, you have to actually call in advance of coming to do the medical training and request that they put in for that date in your child's medical record, so that when you submit documentation from the hospital to say that you came on the date that you said you were coming, that they already knew about it. That's the only way that they'll reimburse. So it's a little tricky. Ask, again, your Medicaid support person, whether it's a coordinator or a nurse manager, how do you avail yourself of medical transportation? There's lots of other ways to get around, like getting around to go to school, to go to college, to go to work, to visit friends, to go have fun. Here in Massachusetts, we have regional transit authorities. They're a little bit cumbersome if you want to try to go from one part of the state to another. But again, if it's the best means of transportation for you, you don't own your own car or you don't drive, the regional transits can be helpful. And other parts of the country do have regional transits. It's worth asking your state's transportation department or Department of Transportation if you have some sort of transit that will help you to get you from place to place if you don't have your own car. We also in Massachusetts have government-supported vans and carpools, and those are ways, again, that can help folks to get around. Some states have a catastrophic illness and children relief fund. Here in Massachusetts we do, as does New Jersey and 2 other states, that can offer some financial support to families that need to buy an accessible vehicle. So it's a huge investment to say we're going to buy a wheelchair van, or even to buy a vehicle that's going to be easier for my child to get in and out of because of their complex medical needs. And so if you can find any government source or charitable organization that will help you with that, it's well worth the effort. I know of a parent who actually got a van with some financial assistance and then had to replace it sooner than the program would allow them to replace it for more funding. So they went and did a GoFundMe program and actually raised $14,000 from families and friends who wanted to help them to get the van, which made that more doable for the family. Local fundraising, throwing a party, and families do that together with friends. Often it's friends doing it for families, in fact, that help to reduce the burden, the financial burden of getting an accessible vehicle. It's also important to note that there are really good resources to find used vans, which many folks don't think about. One of them is to go online to organizations that do charity vans and ask if they have used vans. I was actually on the Toyota website recently and found that they do sell used vans now through the Toyota website. I've also found that the independent living centers I mentioned earlier sometimes have listings, and so that's a great way if a family no longer needs to use a van for whatever reason, they can make it available to somebody else who needs it. So passing it along, as I like to say, is really, really important. In terms of housing, going back on housing, I just want to point out again that the multi-generational homes and cohabitation are important to note. I know for many families, there's multi-generations living together. That helps to support not only the person with the disability, but sometimes that person has the ability to be able to help around the house, help with childcare, or even just keeping children busy. It also helps to lift spirits to see so many generations in one household. So I'm a big fan of that and would encourage other families to do the same. Next slide. Community services, this is where I really love to work. So education, job training and supports, socialization, recreation, and charities for funding supports are out there. The IEPs and 504 plans and individualized health care plans are useful for educational purposes. 504 plans actually can follow you into college and into the workforce when you become ready to be employed on your own. Independent living centers can be helpful with all of these aspects. And when it comes to charities, everyone knows Make-A-Wish, but there's lots of different kinds of Make-A-Wish. So for details, special education services are important for children with special health care needs from the age of 3 to 21 or 22, depending on the state you live in. Special education services are made available to children to help them to access the highest level of quality education that they can in the least restrictive environment. There are federal laws and state regulations to support families. There are programs in every state called the PTI, or Parent Training and Information Centers, that are federally funded and can help families to learn more about the ways that schools can be made more accessible for their children. If you haven't contacted your PTI yet, I would encourage you to do so. And if you need help with finding them, again, here at Mito Action, we can help you with that. The local districts are providing services. Some children go on to collaborative schools here in Massachusetts, and they may have different names in other states. But the local district tries to provide either an integrated classroom setting or a small, substantially separate classroom setting, depending on the child's needs. If that's not successful for any reason, the collaborative schools in Massachusetts are a small, substantially separate program that service children from multiple communities, and in doing so, allow children to have more access to particularly if they have a need for a lot of therapies or individualized teaching services. You'll find kids do well in the collaborative schools. Specialized schools, here at Franciscan Children's, we have a specialized school attached to us. It's the Kennedy Day School. Those are programs that are approved by your state's Board of Education to provide specialized services, and school districts generally will have to pay for a student to be tuitioned into those programs. That means working with your school to explain to them and to really demonstrate why the programming in your local school or in a collaborative school still doesn't meet the needs of your child and helping him or her to blossom. It's a lot of work to get that because it costs a lot of money to go to specialized schools, but it doesn't mean that you shouldn't try. If that's what your child needs, then as their parent, I'm sure that you'll advocate as well as you can for them. The individualized health care plan is really, really important, especially for kids with mitochondrial disease or other complex medical needs, because just like the IEP or individual education plan maps out what it is that the school needs to do specifically for your child to access their educational services, the individualized health care plan will assure that your child can be safe and healthy while at school. And we can help you with finding services around understanding what individualized health care plans are, and I'm happy to help you with that individually. In terms of job training and supports, transition to adulthood services should be a part of a child's school planning from the age of 14 or 16, depending on your state, and it includes paying attention to a child's interests and vocational needs, the skills that they have and would like to develop, opportunities to develop those skills with an eye toward gainful employment, whether part-time or full-time, and supports that may be needed to ensure success in the workplace. So supports, as a reminder, out in the workplace can come from within, meaning that the school may be providing it when they're at school. The independent living centers may send in an individual through a paid position to be a job coach and to be a support to the person when they are working. Developmental disability agencies also may provide those funds. The other way to think about support in the workplace is that it should be done in a natural way, that all of us, when we go to work, find that there's a team that supports us, and the same can be true in the workforce. A dear friend of mine has a daughter who has special health care needs and went to work at Starbucks 10 years ago. She's been there 10 years. She started off just cleaning tables. Something that she really enjoys doing is cleaning. She has gone from there to having been supported to move on to becoming a barista. So she's now actually making the drinks at Starbucks. She has become much more social because she's out in that work situation every 3 days a week. She goes every week. And for 10 years, she's gotten to know not only the people that she works with, but more importantly, the customers who welcome her and are delighted to have her there. So thinking about that, I know that most of us as parents, when our children are younger, are looking for someone else to come in and provide them that support, but we should always be thinking about the natural supports, which at school age includes classmates and friends who want to be helpful to your child at school, and in the workforce it would be those who work with your child, now adult, young adult, and can help them to feel like they're part of the team too. In terms of socialization, humans are social creatures. It's important, it's really crucial to find meaningful opportunities to be engaged with family, to make friends of your own, and to be part of the community. I like to encourage families from an early age with their children, and for young adults and adults too, to be thinking about what interests you. Do you love animals? Might you want to volunteer at an animal shelter? Is there a pet shop nearby that you could work at? How can you also volunteer perhaps to do a dog walking, those kinds of services? Think about what makes your child happy. Think about what makes you happy. And what can you do to get out into the community? I'm an avid reader and at a very early age volunteered at my local public library, putting books on the shelves, actually fixing books, rebinding books when they needed that, putting new jackets on the books. Those were ways that helped to foster my love of reading. And those are ways that others can also. Thinking about what your child likes to do is really an important place to start. And if they don't know what they like to do, then hopefully between school, family, and friends, they're going to be introduced to lots of different choices and choose some of the things that they love. Recreation, again, that builds on socialization, opportunities to just have a good time. Is your child or are you interested in art, music, sports, the great outdoors. Is adaptive equipment something that would be useful for you? Creative thinkers can make almost any activity available to anyone who wants to have fun. Look into the state's Department of Conservation and Recreation programs, too, for opportunities to get out into the great outdoors. Here in Massachusetts, our DCR hosts an annual event in the Boston area where they bring in about 50 different types of adaptable bicycles and allow people to ride along the Charles River to try them out and to see if they might like to use them. They're available for free in our local, in our state parks around the state, in designated state parks, because not all of them have the facilities to be able to store the bikes. But the DCR list has the Universal Access Program and can tell you where the bikes are available. They also have here in Massachusetts through the DCR accessible kayaking, hiking, and also sled, so the ice sled, which is really fun to watch too. So there's lots of things to do out in the public that can be free or close to free, and really, again, help to build the opportunity to get out and enjoy the great outdoors. Or, again, if you're interested in the arts, art, music, those are also really fun things to do. And the VSA, Very Special Arts Program, is a national organization that can help you with that as well. In terms of charities, I just want to touch on the fact that our communities are filled with caring friends and strangers who extend their hearts and their financial support to individuals who have special needs. There are many WISH programs, not just Make-A-Wish, but when we talk about wishes here in the hospital, families immediately say, can we go to Disney too? And I remind them that not everybody wants to go to Disney. Check with your child and ask if that's really what they want. I know of families who have used the Make-A-Wish to redo a child's bedroom, a child with serious medical issues, and not so able to get out and about with visual impairment as well. So they mounted a large screen television on the wall for them. They got touch programming for them to be able to change television channels and go to their DVDs, which they have an automatic library in their computer system. All of those things have made life more enjoyable for that child. There are ways to do things in the yard. I know of families who have put in an accessible playground in their backyard to be able to bring their child out and enjoy the great outdoors, as well as sensory-friendly services inside the home, too, so that sensory playground indoors is fun as well. Whatever it is that your child is interested in, unfortunately, I find that most of the WISH programs go up to age 18. So if your child is 17, find a way to get a WISH now, because unfortunately there's not a lot of WISH programs for adults. There's also local community organizations or chapters like the Knights of Columbus, the JCs, the Kiwanis, the Lion Clubs, the Masons, just to name a few, that receive and fund requests to make dreams come true. And you can also be assured that if you have needed medical equipment or a useful piece of equipment that you want to donate, that those organizations are also helpful too. So check with your local parent-to-parent groups or family voices to ask for help. It's truly a sign of strength. Next slide. It's like, I think we did a good job. We're about 10 minutes to go. Wondering if there's any questions amongst you.
Mary, thank you so much. I appreciate all of that information. That was all really, really helpful. So I do have one question that came in. That's,
sure.
A family that is new to the Mito Challenge, and they're interested in getting support for in-home health. Who do they call? Do they call a private home health agency, or what's the department? Where do they begin that journey to even begin to find somebody who can help in home health care?
Okay, so I talked a little bit about in-home health, meaning skilled nursing, but the other kind of help, and I skipped that, is personal care attendants. And most states, through their Medicaid programs, are funding for an extra pair of hands, I like to say, to come in and support an individual who has special needs so that they can be entertained, supported, and supported particularly around the activities of daily living. So that's feeding, bathing, brushing your teeth, brushing your hair, dressing, The things that we would anticipate that a child by the age of, say, 3 to 5 can do on their own, if that's a challenge for any reason, and I do mean any reason, a family should reach out to either to Medicaid or their private insurance first and ask whether or not they would have access to the PCA, or personal care attendant kind of services. If they have difficulties doing that on their own, if they want to write to me through the Mito Action Team, I'd be glad to directly talk with them about the state that they live in. So that's one way to do that. Our Medicaid programs are usually very good at providing you with funding for that. Again, like the home care nursing, the but line is the fact that the family needs to find the individual to do that and to also train that person. So the good news about training the person is that they will learn to do things the way that they need to do it for your Johnny. So they don't come in with a preconceived notion, well, he needs to get up and get dressed and get ready to go to school in the morning. That's easy. These are the 5 steps. That person's coming in with a preconceived notion. The parents can help that person to understand what Johnny needs in order to get up in the morning and get to school, and do it in such a way that Johnny's going to be receptive that this other person is going to help him to do that. But PC is a really, really important piece of it, and I apologize for missing it the first time. And if it's home care nursing, then you want to do that, again, through your Medicaid benefit or your commercial insurance. Again, I'm happy to help anybody individually, so you can be in touch with Mito Action, and they'll put you in touch with me.
Perfect. Thank you so much, Mary. So we've got just a few minutes left. I jumped the gun on you a little bit there and went on to the next slide. So we've got just about 4 minutes left. If you want to, I'll turn it over to you because you've actually been involved with Marcel's Way a bit longer than I have. Since I've joined Mito Action just 3 years ago. So why don't you share a little bit with the group about the Marcel's Way Family Fund and how this program supports the mitochondrial disease community?
Sure. So about 5 years ago, Marcel's Way Family Fund came to Mito Action, and the goal of the program is simply to offer a helping hand in the way of direct financial support to those who suffer from some aspect of mitochondrial disease. It's a pretty simple application process. You can go to the Mito Action website and look for the tab for for Marcel's Way. The application is fairly straightforward and easy to fill out. Persons who have a diagnosis of mitochondrial disease or are seeking testing to definitively determine that diagnosis can apply to Mito Action for up to $500. At this time, it's a one-time $500 cap. However, if someone came in and asked for, say, $250 to get an iPad for a person that would benefit from having an iPad, they would still have $250 that they could, at a later date, request. But it's been my pleasure to help out in this process. We have helped families to purchase a specialized stroller, a folding wheelchair for an adult. iPads are very popular, both for communication and educational activities. Particularly for folks who are not able to be up and around very easily. The iPad has become sort of the popular with everybody, so you're not any different if you want one and you happen to have mitochondrial disease too. But we've also granted awards for medications, travel for medical diagnosis or medical care, utility bills, and even accessibility needs. So it's a really easy process. Go to the website, the Mito Action website, look for Marcel's Way, you want to fill out that application. You'll be also asked to provide us with a release to talk to the physician that manages your child's or your own mitochondrial disease, and then a social worker or someone in the community that can also verify that the need that you're requesting, which you'll identify in your application, would be beneficial for the person to whom we're going to make that grant. It's a really fast application. I think we can all agree to that. Jeannie processes them really fast. She gets them out to the team. We all make our comments. I try, as the person with that interest in community resources, to follow up with folks if there's more. I'm thinking in particular about a family from the western part of the country who was really struggling financially for a family member, and so we provided the funds but we also contacted them and helped them to find the local, their state's disability organizations so that they could start to get more help in the home. And we've done that on a number of occasions because it's hard to admit this, but it's so hard in our government and community-based services to be available to everybody when the everybody is families like yours and like mine that have complex health needs that take up so much of our energy and time. So it's really important for all of us to remember that there's help out there. Please don't go it alone. You can do it by yourself at home if you must, but don't go it alone. Reach out to Mito Action, reach out, and we will be happy to help you to find the resources in your community. Thanks to everybody for participating. I hope it was a help to you.
Thank you so much, Mary. We really appreciate all the great information that you shared with us today. And like you said, what we want to make sure is that everybody knows that on this journey that they're not alone, that there is help out there. And if Mito Action is not available to provide that help directly, we are here to help direct you and guide you to resources that can give you that support. So we appreciate all of this information. This presentation has been recorded and will be up on our podcast library within a couple of days. So if you want to go back and listen to it, share information. If you have any questions about what you heard today, or you'd like to be connected to Mary or any of the resources, you can email us at info@mitoaction.org. So thank you again, Mary, for this great information. And we will be signing off, and we wish everybody a happy Mitochondrial Disease Awareness Week that starts on Sunday. So we look forward to talking, and we are here if you need us. Thank you, everybody, so much.
Thanks, Kira.